Good evening, this is Matt. We are continuing our series on the conduction system of the heart, and today we are going to present the His-Purkinje system. And this will be a very basic overview because the His-Purkinje system has a significant role in ventricular tachycardia and ventricular arrhythmias. And that is a topic unto itself and beyond the scope of this presentation that I'm doing on the conduction system. So essentially we'll just go over the basics, and we will again return to anatomy, and this is the arrhythmia compendium number 2. Again, Professor Sesto from the University of Mannheim in Germany, near Heidelberg, directly on the Rhine. If you want to take a nice boat ride, you can go right past it. So, anyways, this is our topic for today. If we follow down from the Oberfläche EKG, once again, our German lesson, surface EKG, down to the SA node, or the sinus Knoten, then the Vorhoffkammer Muskulatur, and that is the atrial muscle, the AV node, or the Knoten, and you can follow over to the heart and see exactly where those are. And then we come down next to the His-Bundelsstamm, and that is the His-Purkinje system. Down below is the Purkinje Fasern, or the Purkinje fibers. So, as I mentioned early on in the overview, we go from the bundle of His down to the fibers, or the branches as they're called, and these play an essential electrical pathway for both the right ventricle and the left ventricle. And if there are disturbances in that pathway, for instance, if you have a right-sided heart attack, there may be abnormalities in the EKG, which could include a right bundle branch block. And that essentially comes about because there is a delay in the transmission of the electrical signal through the right side of the heart due to the fact that some of the myocardium has died and no longer transmits electricity. So another pathway has to be found, and that pathway takes more time, and therefore the time to transmit the electricity through the right side of the heart, or through the right ventricle, is longer, and that's how you end up with a right bundle branch block. That can also happen to the left side if you have tissue or myocardium that dies on the left side of the heart, or that is part of the left ventricular wall. So anyways, that is essentially the anatomy of the His-Purkinje system. And again, there will be very specialized presentations on electrophysiology, and at that time we will go into greater depth about the role of the His-Purkinje system in ventricular arrhythmias, and we will next be talking about the last part of the conduction system, where the signal reaches the myocardium of the heart, and the final depolarization and repolarization of the myocardium, and what exactly takes place at that time. And that's it. Have a very good day.